Hey guys, I'm Dr. Jeremy,
Dr. David here.
and we're from Sprouting Health Chiropractic Kinesiology. Today we are going to be talking about vitamin D. Vitamin D is very interesting. We know that vitamin D helps absorb calcium in the small intestines, and that's really important for strong and healthy bones. But there's a lot more to vitamin D than that, and we're going to talk about some things that are in some of the latest research. Dr. David.
100%. So, some research has shown that there are some risk factors is associated with low vitamin D level. For example, bone weakening condition, osteoporosis. In kids, it could be a ricket disease, osteomalacia, which is soft bone syndrome. Okay, it's also associated with depression.
Cancer risk factors are in the research.
100%. Self-harm, suicidal thoughts, and things like that.
Which that's actually in the research is really interesting. 100%. A lot of people wouldn't know that.
So something that happens to us quite recently, COVID. So this research that came out from Italy in 2021 has found that people admitted to the ICU, people admitted to the hospital with severe respiratory symptoms, they have significantly lower vitamin D level in their blood serum compared to people who can manage that at home. Isn't it interesting?
So there's a massive immune bit of research that's really relevant right now, especially coming into winter with all these different viruses, infections going around.
Speaking of winter, right, so winter times we potentially spend less time outdoor, we potentially spend more time inside staying warm. One thing that's really interesting is that glass windows, they actually blocks out UVB, which helps you make vitamin D.
Very important. So vitamin D, talking about that, I think Dave has given us a hint to where we get vitamin D from, and that's of course sunlight, and we can supplement for vitamin D as well. But interesting, in New South Wales where we are,
yes,
how long do we need to spend in the sunlight to have healthy levels of vitamin D?
Yep, so in summer we need about 6 to 8 minutes of sun exposure to get adequate vitamin D every day.
Very interesting. That's summer, wasn't it?
That's summer.
Yeah.
In winter, we actually need 5 times longer to get the same amount of vitamin D made in our body.
And that's of course because the sun's further away, but it's also on a less of a steep angle, so we don't get as intense of exposure on our skin.
Yes.
It's very interesting.
So diet can help with that, right?
Absolutely.
Jeremy? So cod liver oil is a really good one, oily fish, salmon, mackerel, mushrooms is a really good one for vitamin D, and also supplementation.
Yeah, you can supplement vitamin D if needed.
100%. So if you have any health concerns, anything that we can help with, have a chat to one of our amazing chiropractor in Sprouting Health.
And if you'd like any other help with any other immune markers, for example, too, through nutrition, we're happy to help with that. Because we are doctors of chiropractic and kinesiology, and because we're holistic, we don't just look at your structure, we look at your biochemistry as well, and we do lots of other things here. We even use a technique called NET, which a lot of you may or may not already know about, which is some of the subconscious mind work that we do. It's very interesting stuff and how that affects your body. So if you need any help, guys, reach out, consult with one of our doctors of chiropractic, and make sure you have a great weekend and get some sunshine.
See you guys.